Did you know that colorectal cancer, which includes colon and rectal cancer, is the third most common cancer and the second leading cause of death in the United States? But the good news is that a simple test can reduce the chances of developing this disease by up to 90%. Yes, the colonoscopy, the most feared and avoided procedure, can save your life. But is a colonoscopy suitable for everyone? What are the pros and cons? In today's video, we will demystify the colonoscopy in 5 steps, showing how simple and important it is for your health. Curious? But first, go ahead and give this video a thumbs up and subscribe to the channel. Let's make this the most liked video on the channel ever. Have you or anyone you know ever had a colonoscopy? How was your experience? After you've watched the video, drop a comment below. A colonoscopy can feel pretty intimidating for anyone who hasn't had one before, and it's often the test that makes people the most anxious. The reasons? Lack of knowledge, prejudice, fear of feeling unwell during the preparation, which can be uncomfortable, or feeling pain, which does not happen. But the truth is that a colonoscopy can save your life, and the process is simpler than you might think. To understand how this exam works, the first step is to know the instruments that will be used for the procedure. And thus, we will get to know the colonoscope, the main instrument used in a colonoscopy. The colonoscope is an essential medical device for diagnosing and treating intestinal problems. It is a long, flexible tube equipped with a high-definition camera and a light source at its tip. This device is designed to be inserted through the anus and slowly advanced through the rectum and colon, allowing the doctor to visualize the inside of these organs in real time. The camera on the colonoscope transmits images to a monitor, where the doctor can closely examine the walls of the colon. This is crucial for identifying abnormalities such as polyps, inflammation, ulcers, and even early signs of cancer. In addition to the camera, the colonoscope has channels that allow the passage of medical instruments, making it possible to perform biopsies during the exam. Now that you know about the instruments, let's jump right into the steps of the colonoscopy. First, preparation. This is perhaps the most crucial and can be the most uncomfortable part of a colonoscopy, as it ensures that the intestines are clean for a perfect visualization. You'll start by adjusting your diet a few days before the colonoscopy. Typically, you should follow a low-fiber diet for 2 or 3 days, followed by a clear liquid diet on the last day. This includes broths, pulp-free juices, tea, and gelatin. On the afternoon or evening before the colonoscopy, you will take a laxative formula to purge your intestines, ensuring everything is eliminated. Prepare to spend the next few hours frequently going to the bathroom. Get comfortable, and then have a good night's sleep. The colonoscopy usually takes place the following morning. Pay close attention, since it's critical to complete this first step correctly. The goal of these preparations is to keep your colon as clean as possible for the colonoscopy. If it isn't, the doctor may be unable to see what they need, and in that case, the exam may need to be rescheduled, and you'll have to go through the preparation again. 2. Exam day. On the day of the exam, you'll typically lie on your side, usually the left, with your knees pulled up to your chest. This position helps make it easier for the doctor to insert and advance the colonoscope. To ensure comfort and minimize pain, sedatives and painkillers are often administered intravenously, so you don't feel any discomfort. After the patient is suitably anesthetized, the doctor begins inserting the colonoscope through the anus. As the tube progresses, the doctor inserts air to stretch the colon, increasing visibility. The images obtained by the camera are projected onto a monitor, allowing the healthcare provider to examine the colon and rectal linings in more detail. 3. Polyp removal. During the exam, if the doctor finds polyps or suspicious areas, they remove them right away. Polyp removal is one of the main advantages of a colonoscopy. Polyps are abnormal tissue growths that stick out from the lining of the colon or rectum. Although many polyps are benign, some can turn into cancer over time. Therefore, early removal is crucial for colorectal cancer prevention. The removed polyps are sent for histological analysis, where they are examined under a microscope to determine their nature and to plan any additional treatment that may be necessary. Before we move on, I've got some exciting news to share. If you want to get more engaged, I'm excited to inform you that we now offer channel membership. As a member, you'll pay a small monthly fee and unlock some amazing perks like early access to new videos, priority replies to your comments, members-only shorts, polls, quizzes, and special emojis and loyalty badges just for you. It's a fantastic way to support the channel and connect with us even more. Just click the join button and let's make this experience even better together. 4. Recovery. After the colonoscopy, you'll be taken to a recovery room where the medical team will monitor your vital signs and ensure you're recovering well from the sedation. Most people feel drowsy and a bit disoriented right after the exam, but these effects wear off quickly, and you'll be able to go home the same day. It is also normal to feel slight abdominal discomfort and cramps, but these symptoms disappear shortly. 5. Results and follow-up. The doctor will give you a report with the results of the exam and follow-up recommendations. If no polyps are found, you will probably only need to repeat the colonoscopy after a few years. If any polyps are removed, the final results may take a few days to be ready. Depending on the findings, the doctor may recommend dietary adjustments, medications, or more frequent follow-ups. It's important to follow all post-procedure instructions provided by the doctor, including gradually reintroducing solid foods and drinking fluids to help expel any residual air from the colon. If you notice any signs of complications like heavy bleeding, fever, or severe pain, please reach out to your doctor immediately. See how simple it can be? With this information, we hope you feel more confident and prepared for your colonoscopy. And now, to wrap things up, let's answer some questions you might have. One of the first questions that may come up is, who should get a colonoscopy? This procedure is mainly recommended for people 50 and older, as that's the age range when the risk of developing colorectal cancer increases significantly. However, individuals with a family history of colorectal cancer, polyps, or inflammatory bowel diseases such as Crohn's disease and ulcerative colitis should consider starting screening earlier, usually at age 40 according to the American Cancer Society, or even sooner as advised by their doctor. So, if you're in this age range or have risk factors, talk to your doctor about colonoscopy. Are there any side effects or dangers associated with the exam? While colonoscopy is a safe and common procedure, some side effects can occur. The most common include bloating and gas due to the air introduced into the colon during the exam. Some people may experience minor cramping or abdominal discomfort, which usually subsides within a few hours. In rare cases, there may be bleeding, especially if polyps were removed, which is a more serious but extremely rare complication. Before undergoing a colonoscopy, it's essential to follow some guidelines, as the success of the procedure largely depends on how you prepare. Inform your doctor about all the medications you are taking, including supplements and over-the-counter drugs, as some may need to be stopped or adjusted before the exam. Pre-existing health conditions, allergies, and history of reactions to anesthesia should also be discussed with your doctor. Here's an important tip. Prepare some questions for your doctor. Ask about the necessary preparation, which usually involves a liquid diet and the use of specific laxatives to cleanse the colon. Ask how long the procedure takes and what to expect during and after the exam. Also, ask about the specific risks for your case and what the recovery will be like, including when you can resume your normal activities. Having this information helps alleviate anxiety and ensures that you are well prepared for the procedure. And to make your life and your exam easier, here are some other guidelines to ensure your colon is completely clean. First, follow a clear liquid diet in the days leading up to the exam, including broths, pulp-free juices, tea, and gelatin. Drink plenty of water to stay hydrated and aid in the cleansing process. Use the laxatives prescribed by your doctor exactly as directed, as this is crucial for good preparation. Also, avoiding foods high in fiber and residue in the days leading up to the exam can help facilitate the colon cleansing process. Examples of foods to avoid include raw fruits and vegetables, nuts, seeds, whole grains, and foods high in grains. Opt for lighter, easily digestible foods such as white bread, white rice, pasta, and lean meats. Remember that early detection is key to the prevention and effective treatment of many diseases. Don't let fear or lack of information prevent you from taking care of your health. If this video helped you out, give it a thumbs up and share it. It might really help someone else who is afraid to get a colonoscopy. Have you ever had a colonoscopy screening? How was your experience? Drop a comment and let's chat about it. If you want to stay in the loop with more health tips, just hit that subscribe button and turn on notifications. We release new videos every week. Your likes and comments really keep us going. They show us what you want to see more of. And before you go, check out these 2 videos we selected specially for you. I think you'll love them. See you in the next video. Bye.